Amy, in an interview with The Telegraph, the World Health Organization's top European official, Dr. Hans Klug, said that a second wave will hit Europe, second wave of COVID-19 will hit Europe this winter, and it will be more deadly, in part because of the projection that it will coincide with outbreaks of other infectious diseases like the seasonal flu.
Can we get this through this one first, please? Our hearts can only take so much, but okay, it's a fact.
Do we know that? Is that established? It doesn't seem to be. That seems to be another bit of conjecture on the behalf of that World Health Organization official, as we are still in an area of uncertainty about a second wave, even though, yes, Dr. Fauci, Dr. Gottlieb,
Doctor, can I get a doctor?
Suggests that it's more likely than not, but we don't know the nature of it or the lethality of it.
Right, but also, too, it could also die out. We don't know. There's a lot of possibilities. Nobody knows. That's why nobody knows what they're doing, because it's a novel coronavirus.
Yeah, sort of. This seems to me another example of a problem that has been consistent throughout, and certainly with the models. Let's predict the worst case scenario and model policy based on that rather than the most likely scenario. You can plan for the worst case scenario, but in terms of our policy response, we're going to use as a baseline the most likely scenario and then have the backstop of the worst case scenario. Maybe if we had taken that approach, sort of the measure twice and cut one approach, we wouldn't have done the ready lockdown aim nationally and, frankly, internationally. That's the consequences of which we're just starting to get some indication of.
And I don't want to scare people, but I know that Governor Pritzker said yesterday that all four parts of our state are going to be ready to open at the end of the month. Lori Lightfoot still hasn't decided what phase we're going to be in, so she has a final say about Chicago.
For more on the topic, we're pleased to be joined by Alex Berezow. He is Vice President of Scientific Communications at the American Council on Science and Health, a PhD microbiologist, and a columnist for USA Today. Alex, thanks for joining us again. Appreciate it.
Thank you. Greetings from Poland, where they have still the borders are closed and I can't get on an airplane. So
really?
I'll be here for a while.
Well, talk to us. I mean, I know we have so much to deal with in real time, but part of the lesson to be learned from this is planning ahead and deciding exactly how implementation will proceed. So thinking about the second wave and these health officials that are weighing in on the topic of a second wave this fall and winter, this is important because you have a lot of people like me who are concerned that if we're not thinking about this and talking about it now, we could have a yo-yoing where we open up only to turn around and lock down, and we're forever in this back and forth. So your assessment of some of these pronouncements that you're hearing.
Well, there's a very good, very smart infectious disease epidemiologist named Michael Osterholm, and he's at the University of Minnesota, and he's actually an advisor to my organization, the American Council on Science and Health. And he has put out a report with some other very respected epidemiologists that concludes that a second wave is incredibly likely. And the reason that they came to that conclusion is because they looked at previous influenza pandemics. Now, influenza and coronavirus are different viruses. They're not exactly identical, but some of their dynamics in human populations do seem to be rather similar. Both viruses have spread around the globe really rapidly. There are no immune people, right? Because there's no one's ever seen this virus before, so everyone is completely susceptible. So they looked at 8 previous influenza pandemics going back to the 1700s, and they found that in 7 of 8 cases there were substantial, very large second waves. And so it's very reasonable to predict that there will be a second wave probably this fall, maybe early winter, late autumn, and we should prepare for that.
But do we understand or does Osterholm have any insight into what he thinks is the most likely scenario in terms of the severity of the second wave? Is it going to be more or less, or do we have any sense of that?
Don't know. They proposed three scenarios. One of them was a gigantic, large second wave, but they also predicted the possibility of just a bunch of subsequent smaller waves. So it is wait and see. But the idea that it's going to come back is the consensus is yes, it will be back.
Okay, so then when it does come back, do you think we'll have these draconian lockdowns reinstated again? Or would there be some sort of herd immunity? I mean, in Illinois, 96,000 people have tested positive. And we don't know how many of those have recovered because they're not keeping that data. But I know that a lot of them are asymptomatic. So
yeah,
what does that
so
mean?
I have a hard time believing that we're going to have achieved a substantial amount of herd immunity. I mean, the numbers are really all over the place. In Stockholm, where they didn't do a lockdown at all, about 25% of people tested positive. So there's still a substantial number of people who haven't gotten the disease yet. It's really hard to say. I have not seen any really reliable numbers on the prevalence of the disease. Here's what I'm afraid of. I'm afraid that no matter what happens in the fall, people are going to be scared and they're going to sequester by themselves anyway. And I think our economy is going to take a gigantic hit in the fall. Even if the government does not mandate social distancing, I think people will do it themselves. And I think the economy will take another giant hit in the fall.
Is it your view that whether we want to admit it or not, we're essentially now pursuing the Swedish model of herd immunity, or we will be in short order?
I don't think there's any way around it. I wrote an article about the inevitability that everyone's going to get infected. And this isn't just my opinion. This is the opinion of a Swedish epidemiologist who said that this lockdown is clearly not going to work, because if the whole purpose of the lockdown is to prevent the virus from spreading, it's futile. This thing is going to spread. And so his concern was that we're doing this massive damage to the economy, and lockdown's going to have all sorts of unintended consequences in terms of public health and economics. And ultimately, the goal of stopping the virus is not going to work. And the people who are most vulnerable, they're going to get infected anyway. It's just their infection is going to be delayed. It's not going to happen this year. It might happen next year. And so he thinks, and I agree, that the strategy should switch to making sure that the people who are most vulnerable are protected and making sure they get adequate, sufficient care. But then everybody else kind of needs to keep calm and carry on.
Well, Alex, let's talk about the people who are doing the right thing, who are, wiping down the knobs and the door handles and, boosting their immune system and exercising and working out. I mean, is everybody going to get this disease? Or if you, are healthy and have lived a healthy lifestyle and have gotten your immunizations, is it not going to come and get you?
Well, there's nothing you can do to boost your immune system. Your immune system is what it is. I mean, if you eat a reasonably balanced diet, and which by which I mean not sausages and Twinkies every day, you're going to be a healthy. Your immune system is going to be just fine. And if you're fully vaccinated, you're going to be just fine. But with coronavirus, this is a completely new virus. Nobody has seen this before, and that's the problem, is that a virus that comes into a population where everybody is susceptible, it just sweeps right through the population, and everyone's going to be exposed and or infected at some point. And so, you can be a star athlete, but that doesn't matter. A virus doesn't care about that. If you've never been exposed to it, it can take advantage of your body.
So there's some that are arguing that right now the way to deal with eradicating the virus and inspiring confidence in people to reopen and resume their lives, their regularly scheduled lives, or at least many aspects of their regularly scheduled lives. We need to ramp up to 5 million tests a day, and we have the capacity to do it. This is Alex Tabarak and others at George Mason University arguing this. We need to do robust contact tracing. We need to quarantine those who are sick and convert hotels into places where we quarantine the sick, and we need to also do sort of the funding to support the warp speed of vaccine development and essentially underwrite right now the manufacturing capacity for investing in the 15 to 20 potential vaccines that show the most promise, so that we're ready to go whenever any one of them may click and prove ready for wide distribution?
Well, I think that one of the benefits of working in academia is that you can propose policies that aren't based in reality. Um, I'd like to have a golden toilet seat on my fusion-powered spaceship to Mars,
Hmm.
but that's not going to happen anytime soon. And so, the idea that we're going to be running 5 million tests a day, okay, I don't. That does not sound even remotely reasonable or realistic to me. There's been a report now, I think it was in the Washington Post, that Utah has so many tests available and people are not showing up to just voluntarily do the testing. They actually put up billboards asking people, hey, we've got tests, come and get tested for coronavirus, and people aren't doing it. And so now there's a surplus of tests and people aren't volunteering to get tested. I think there's a certain amount of fatigue. Yeah, well, there's a certain amount of fatigue that's set in, right? Like we've been lectured now every day since February, and people are getting tired of this. We want to move on with our lives. And, like I said, academics have the luxury of proposing policies that simply aren't based in reality.
But if you have a cold, should you go get a test? Or if you think you have allergies and you're not sure, should you go get a test if they're free and they're available?
I mean, I don't know.
Decision?
It's a personal decision. I got really sick back in December. And there's now evidence that coronavirus was in Seattle, where I live, when I'm not stuck in Poland. That the coronavirus was in the Seattle area in around December, and I'm personally curious whether or not I got infected. So I would go, but is that going to really have any major public health implications if I test positive? Well, not really, because I'm fine now. I'm healthy. So for curiosity's sake, I would go, but I don't know if mass testing is really the answer to our problems here. Partially because these tests have fairly substantial false positive and false negative rates, and so there's mass testing is a limited process. It's not a perfect process.
Since one of the things we do know, 80% of all COVID-19 related deaths in Canada, nursing homes. In the States, it's pluralities to supermajorities, depending on the state, of the COVID-19 deaths are nursing home residents. What can we do prospectively, thinking about a second wave and thinking about a more textured or nuanced policy that would protect the truly vulnerable, like those in nursing homes, but allow for the younger and the healthier to continue the resumption of their lives?
Well, if I was running things, and if I was, I guess, the dictator, would be my policy. My policy would be, if you're healthy, keep calm and carry on. Go on with life. If you are elderly or immunocompromised, we will encourage you to consider staying home and practicing social distancing. Facilities like nursing homes, they need to be on something resembling a lockdown because, a virus gets in there, it wipes out the entire population of people there. So that's what I would look at. But this idea of canceling sporting events and telling everybody to stay home and no restaurants, this is ridiculous. And so that's how I would handle it. I think that's a more reasonable approach. You protect the vulnerable, and everybody else carries on.
Just with respect to that, what about any sort of rethinking of nursing homes generally? I assume that there's going to be some of that done on an individual basis. I'll take a home health care worker rather than a nursing home just because of exactly what you said. But is there any policy change that should be made with respect to the operation of nursing homes, do you think?
I'm not terribly familiar with nursing home policy. I know that there are different kinds of nursing homes. There are some that are rehabilitation centers, and there are some that are more like convalescent homes. That are, some are more like hospices. So I don't really know exactly. Obviously the policy of putting sick people in nursing homes, like what New York did, bad idea.
Yeah.
Right.
Yeah.
So deadly idea.
So might want to rethink that one. Yeah. Right. So that's about the extent that I can say on that one. I'm not terribly familiar with nursing home policy.
He is Alex Berezow. He is Vice President of Scientific Communications at the American Council on Science and Health, a PhD microbiologist and columnist for USA Today. Alex, thanks so much for joining us as always, and stay safe in Poland.
Thank you very much, guys. Have a good one.
Take care.
Hopefully you'll get back here soon. And he joined us on our turnkey.pro answer line.
There's only one radio show in Chicago talking about today's biggest stories and telling you what they really mean. That show is this one, Chicago's Morning Answer on AM 560, The Answer.
You've all probably heard of asbestos and know that it's dangerous. You may also know exposure to asbestos is the only known cause of mesothelioma, a deadly cancer. People who were exposed to asbestos decades ago are being diagnosed to this day with mesothelioma. That's because it can take as many as 30 or even 50 years to develop. But did you also know there is money to pay victims of asbestos exposure from years ago? An estimated $30 billion is available to help compensate victims and their families. If you or a member of your family have been diagnosed with mesothelioma, you may be able to receive some of this money without ever going to court or filing a lawsuit. Get a free legal review today. Call Sokolov Law at 1-800-972-3229. That number again, 1-800-972-3229, 1-800-972-3229. Call today, 1-800-972-3229.
The world is quickly changing on a daily, even hourly basis. Is your business prepared? One thing is certain, they need to stay connected no matter where you or your employees are located. With so many working from home right now, Turnkey IT provides